I thank the chair for this hearing and our witnesses for the testimony. I'm going to follow up on what Ms. Myers said, Ms. Brooks, because when she talks about 4 or 5 patients being served in Wheeler County, there are only about 1,700 people in the entire county. And if you drove from Fossil, Oregon, the county seat, to the nearest hospital, it would be 142 miles each way. So, I mean, these are enormous areas, and my colleague from New Mexico, Mr. Lujan, talked about the size of his district, and everybody kind of gasped. His is 47,271 square miles. Mine's 69,341. So when we're talking about providing basic services in these remote areas, this is life and death, literally life and death. And that's why this matters so much, that when some contractor, some bureaucrat, some rule writer comes up with one of these things back here in Washington, they don't have a clue what they're doing in real lives out on the ground. And that needs to change, and it needs to change now. Let me go to Ms. Myers. As you know, the original requirements for a physician face-to-face encounter were intended as a program integrity measure to protect from fraud and abuse. Do you think this bill that we have before us eliminates or dilutes that protection against fraud and abuse?
Absolutely not. The requirement for the face-to-face encounter with the patient is still fully maintained with the proposed bill, and it further is required and a condition for payment under the Medicare home health benefit. The physicians still must certify the patient's eligibility for coverage, and the bill provides for a cleaner, more standardized process by which we would be able to operate and be able to focus more on patient care rather than chasing paperwork.
I had a very positive discussion with Mr. Lujan during the break when we went to vote on the House floor and come back, and he and I intend to work closely on this legislation. Mr. Griffith and I had a very good conversation. Imagine he'll talk about this. I won't steal his thunder, but I'll give him full credit, and that is perhaps within the context of this legislation, we should allow face-to-face to qualify over electronic devices. Again, if I could take my phone into the home and have the doctor on the other side, which we all know can be done today, why should we have to transport a patient 142 miles over icy, foggy roads for a face-to-face so that they can go back home?
Absolutely, and in the case of my father, right before he passed away, I was attempting to get home care for him, but he couldn't stand up, literally make it to the car and have my mother help him to get into the car to make it into a physician's office. So it is very challenging, and that may present an opportunity.
We went through the same sort of event with my mother-in-law, who had severe rheumatoid arthritis, was in very bad shape, and they would have to transport her by ambulance or the equivalent, and they'd have to do the blood pressure test before she left, which drove excruciating pain throughout her body. And then as soon as she got to the hospital or whatever, they had to do it again. I mean, there are so many stupid things in delivery of care right now, driven by either litigation or regulation, that we need to get past so we put the patients first. I ask unanimous consent, Mr. Chairman, to enter into the record a statement written by Jeffrey Weil, who's Division Vice President for Operations in the Northwest for LHC Group. Jeff's responsible for the operations of Three Rivers Home Care in Grants Pass in Medford, Oregon. He says that just for 2014 and 15, his company has had more than 393 claims denied for inadequate face-to-face documentation. Each and every one of these claims had documentation signed by a physician. However, in most cases, the Medicare administrative contractors denied the claims because they deemed the physician's narrative to be inadequate. Many of these denials were reversed, but they currently have more than $1.5 million of denied face-to-face encountered claims tied up in appeals at various stages. Ms. Myers, can you describe in more detail the impact that claim denials and the subsequent...
Without objection, so ordered.
Oh, thank you, Mr. Chairman. Appeals associated with Medicare home health face-to-face requirement has on patient care and home health agency operations, particularly in these small and rural areas.
Absolutely, and as Jeffrey Weil indicated, many of the agencies across the state are experiencing very similar situations with thousands of dollars pending. Certainly the impact of patients occurs where the physicians these days are getting, arguably very fed up with the documentation requirements, and that they simply have said to some of our providers, forget it. The documentation is too much. It takes too much time and too much time away from patient care. And unfortunately, in some cases where the physician is struggling over with this documentation to make a referral for home health care, they're just simply saying no. So the patient gets caught in the middle. And as I've said previously, the denials are plentiful on a lot of technicalities and semantic issues. And certainly that needs to be fixed. And we think that this bill would help tremendously to do that.
Chair, thanks, gentlemen. Now recognize